Drug-free youth, come on and thrive with us. They've been enjoying our virtual Malasadas in the KUAM News Zoom room. I hope you like that virtual Starbucks, too. It's decaf.
Delicious.
The virtual Malasadas, it's low to no fat. So feel free to have a couple. Hey, after that oversight hearing yesterday, this is going to be a walk in the park, guys. Good morning from the Department of Public Health and Social Services. At 7:27, we have Annette Uggan, who's the contact trace lead, and Dr. Annette Pabutsky, the territorial epidemiologist. Good morning, ladies.
Morning.
Morning.
Well. So we have a new executive order out. And it looks like more things are opening. I'm going to start with Dr. Ann. Are we at a place, and are we confident with the first easing of restrictions and the monitoring that went on with that to now open more businesses and establishments and ease more restrictions?
Well, that's the governor's call, and the Physicians Advisory Group advises her on things like this. Our numbers are still not where we want them to be, but they are coming down, but we are seeing deaths almost daily. Yesterday, I did the calculations comparing Guam with Hawaii. Guam has, as of the 30th of September, so we have almost 2,500 cases in a population of 169,000 and 49 deaths. Our death rate is 29.1 per 100,000 population. Hawaii's death rate, with a population of 1.4 million and 1,200 in some cases, is only 9.6. That's the death rate per 100,000. Our case incidence rate, it's up to September, is 1,478. Hawaii's only 874.2, and we're a lot smaller. So we have much higher infection rate and, well, at least incident rate, and much higher death rate. And in the words of Anthony Fauci, never underestimate a pandemic. Last month, he talked about we shouldn't underestimate a pandemic, and he used the analogy of HIV and AIDS. And where it started in the 80s, it was like, oh, it's just a few gay men. Who cares, you know? And then it was 5 gay men, and then 26, then thousands. And now we have millions of people who have been infected worldwide. It's a worldwide pandemic, and millions of deaths. So never underestimate a pandemic. We're just at the beginning of this. So we just have to see what happens. If you were talking about the churches, I saw some media postings from the Philippines where they showed the inside of a large Catholic church where people were sitting 6 feet apart, wearing masks. Let's see what happens when we open up, because people can't stop wearing masks and social distancing. And just because things ease up and open up doesn't mean you have to stop what you're doing. You still have to wear a mask. You're going to have to wear a mask for 2 years. So stock up and wash your cloth mask. And you're still going to have to social distance. It's a respiratory illness. It moves a lot faster than HIV/AIDS. And it's going to be with us for a long time. And I know people think we have to live with this virus. Yeah, but these kinds of analogies where we talk about it's war and we're going to expect casualties. Here's my other thing. There's a lot of premature mortality going on. And there's disproportionate mortality. If you want to discuss that, I'm happy to do that.
Dr. Ann, okay, those numbers didn't sound so good, that comparison between Hawaii and Guam. And how much of you've always said that, you know, the decision is up to the governor and the Physicians Advisory Group, but how much of a voice does public health? Because people are out here talking crap about public health, you know, like, oh, they're not doing their job or whatever. So how much of a voice does public health have on this Physicians Advisory Group when these decisions are made?
Well, of course we participate, but the ultimate call is the governor. And so people, yes, we know people are talking about public health. If you open things up, we're probably going to see another surge. That's how these things are patterned, and we will try and deal with it. We have a lot better.
Sorry.
Is that out of loop?
Sorry, no, somebody's trying to call me.
Yeah.
We have a lot better testing capacity now, and The problem, again, is our infrastructure and what's going on at the hospitals. And they're seeing non-COVID patients now. Dr. Cabrera was showing some of the stats on the hospitalizations, and there's other things happening besides COVID-19 that we have to also address.
Right.
Dr. And how many people are in the Physicians Advisory Group?
There's about 20.
Well, how many seats does public health have?
Well, there's myself, and then there's the two physicians from Guam Memorial Hospital. And Dr. Manglonia was also on it. She still is, but she's not representing public health.
So it's just you.
And of course, they ask public health to participate as needed when they have specific questions, and they confer with the director. So there's a back and forth that goes on.
Right.
Okay. So,
I mean, I don't know, Doc. I'm just frustrated because I can see that you, as a subject matter expert, I mean, you're the territorial epidemiologist. You kind of know about this kind of thing. So when we hear about these decisions to reopen, and they come out in the middle of the night with no supporting information whatsoever, and then we get you on in the morning and you're saying, hey, if we open, we're going to see another surge. Or, hey, our numbers are not where they need to be to open. And, hey, it's the governor's call. And it's frustrating because I know a lot of good classified employees who try to do their jobs and, you know, they get muzzled or they get caught up in the politics. So it's just really hard to decipher and to make sense of what we're hearing from what's allowed to open and what you're saying from, you know, an epidemiologist standpoint.
Well, I tend to have a more pessimistic view because I do look at the statistics. And right now I am looking at the deaths. I'm looking at the deaths and the death certificates and trying to make sense out of some of the disproportionate mortality we're seeing and the premature mortality. And it's not nice looking at these deaths. It's really not nice to see. It's terrible. I mean, these are innocent bystanders. So it doesn't, I tend to be more pessimistic. The other thing is we keep going back to this. It really depends on how the community behaves. If we open things up and everybody just says, oh, great, the pandemic's over, behaves as if, and goes to bars or the bars are still closed. Okay, they go to church, then they start having fiestas and family gatherings, and then we see more and more spread. It really depends on how seriously people take this.
Yeah,
there still is virus out there. It's spreading. It's in workplaces. We're seeing it in some congregate settings. There's a lot of household spread. And Annette can give you a little more, specifics on that. But somebody was talking yesterday, why do we see so much in Chamorro, Filipino, and of course Chuukese households, including hospitalizations and death? Because these are the people who have multi-generational houses. And with the Chuukese, they might be in overcrowded housing. So you're going to see more spread there. So
yeah,
it really depends on how the community responds. And it doesn't matter how pessimistic I am and how optimistic the Physicians Advisory Group is. They want to see the economy open up. And I think that's also important. But, you know, when my job is counting the sick and the dead, it's not a nice job. Sorry, I tend to be more pessimistic when you see very, very sick people and people dying. And by the way, we went through the deaths. Half of them have the comorbidity of diabetes. And of those, 1/4 have end-stage renal disease. It's a huge risk factor.
You say pessimistic. Some people may say realistic.
We're working with the Diabetes Community Coalition on that and to do some more education on how important it is for people with chronic conditions to manage their disease properly.
Right.
And also, if you're really sick, maybe you can go see your doctor if you're feeling sick, and they can test you, especially if you have a comorbid condition. And if need be, you know, if you're not, you don't have to be hospitalized. Maybe they can manage it somehow better with whatever, and you know, counsel you on what you should be doing for the elderly people with chronic conditions.
Doc,
those are the risk groups.
Yeah.
3/4 of the deaths are people over age 55 with chronic conditions.
When you talk about it's up to the community, well, I think we failed because you know, we've been locked down for 7 weeks and things are just getting worse. Right. So I don't anticipate.
They're getting a little better. The cases are going down, but the deaths that we're seeing they lag because these people who got sick and then died, this started in August and it went through September. There's always a lag because some people might get sick and last for weeks on a ventilator in the hospital and before they die. And that's not nice, but this is what happens. So yes, the numbers are going down. It's not down to where we really should be, we're all back to normal. But they are trying to open things up. Businesses want to open. People want to go back to work. And of course, eventually they want the tourists to come back. And they keep touting Hawaii's going to bring the tourists back. Well, let's see what happens over there with that.
Let's go over to Annette now. Good morning, Annette. When Dr. Ann says it's getting a little better, just looking at the results that were reported yesterday, 62 positive tests out of 434 tests taken.
Yep, it's still double digits. Like Dr. Ann said, it's not where we want it to be. We want to go down to single digits and eventually to zero. Unfortunately, just even comparing last week's sit rep to yesterday's, the 1 week difference, the majority of our new cases that, in that 1 week time, 101 were household contacts. And so that's the biggest group of contacts that had an increase, comparing last week to this week. And it is unfortunate, but it's to be expected. They're the ones in close contact, exposed on a daily basis. And like Dr. Ann mentioned, it's the multi-generational, large households that we have here on Guam. I mean, it's just our culture, right, as Pacific Islanders. And so unfortunately, we are seeing more and more household members who are turning positive, as well as work contacts. And so again, it's that ripple effect that we've talked about. And unfortunately, we're seeing, people who are still sick, going out and about, visiting family and friends, going to work, exposing, family, friends, and coworkers. And then those coworkers bring it home to their family, and then it just starts all over again. Household members start to get sick. Or you'll see households where multiple members are symptomatic, and then once we get them tested, they're becoming positive. And so that is our biggest challenge as we still see these double digits, And so, again, we have to encourage people. Like Dr. Ann said, social individual responsibility. And I know we have some households who've done great, some workplaces too that do their part, and we don't see ongoing transmission in those settings, but we unfortunately have those other areas where it's just 2-3 households. They're next door to each other. There's constant moving back and forth. Oh, we ride together in the same car, so they're packed into the vehicle. They sleep over at each other's houses, even if someone's symptomatic, or they're helping take care of the child. And that's just something that our team has to work with, make sure, we educate them, test them. If they need to be, separated, be positive cases put in isolation facility, or exposed individuals put into quarantine facility, we work that out with our other teams in the department, just so we can help stop the transmission and continue to bring those numbers down.
What are the numbers showing out of the government quarantine facility? We just implemented the 6-day early or 7-day early test out for home isolation. What are the numbers showing for people coming into Guam? Or a lot of them have COVID or not?
We are seeing a few that 1 or 2 on the test out process that's been implemented due to the judge's order. And so fortunately, we've caught those individuals before they're allowed to go home and home quarantine. So can you imagine if we weren't doing the government quarantine for arriving passengers, if we're seeing 1 or 2, being tested out on a daily basis, that can lead to about 3 cases each, and continue on and increase our numbers of positive cases. And so I know it's not everyone agrees with it, but again, it's something that has shown, we've had over 100 some cases tested positive in quarantine. And so can you imagine the ripple effect if we did not find that out and they were just allowed to, go back home and again, we're dealing with those who are non-compliant while we have others who are very compliant. I mean, we hear it out in the media, the ones who complain and are not happy, but we have hundreds more who are thankful that, we're doing what we need to do. We've had people ask us to put them in isolation or quarantine. So that just speaks to those people who are concerned about their family and loved ones and are being responsible and wanting to make sure that they're not the reason why it's spread over to family and friends or coworkers.
Right. And I think also some people are upset that they've applied for, hardship release and they weren't, where other people were getting special treatment. So
Yeah, without a hardship.
Yes. It's understandable, and
Yeah.
it's something, again, we've updated, revised, adjusted our processes as we've gone along, and again, it's something new for all of us. It's a novel virus, and and as we see the data, we strive to improve, be more efficient. We are concerned and we are compassionate about people's needs, and why that's definitely the hardship. But again, our overall goal is the health and safety of the people of Guam, and that's the utmost importance to us. And so we try to balance that out, and unfortunately, as you said, we're being bashed left to right. We cannot please everyone, but again, it's the health and safety of our people is what we strive for.
Right.
We had a comment here. Daycares can open, so child care centers are able to open Monday. What about schools, Dr. Ann?
I'm not sure. I think it depends on whether the schools are ready. I really don't know. You might want to get someone from DOE or the private schools on.
No, I didn't see that.
I really don't know the details because the talk was they have to be prepared to open and have whatever their procedures are in place for social distancing kids, which is really hard.
I don't think it's not on the list for
it's
sure
not on the
because
list.
we're under PCOR 1.
People are
or
just saying,
PCOR whatever,
asking,
1
right?
point something.
The logic, I guess, is that, if daycares can open, well, what about schools?
I haven't seen the executive order. I just came straight in and talked to you guys.
No, Doc, they're not
it's
allowing
not.
schools
It's
to
not.
open. Yeah, we're just saying that people are thinking, if daycares can open, then why can't we open schools? So why can't we open schools, in your opinion?
Well, I think we probably should if everything's going to be opened up. But again, they have to have some kind of procedures in place for how they're going to do social distancing while the kids are inside classrooms. I think some of them will still be online, like the high schools. Don't the kids have tablets or something? I really don't know. You're going to have to ask. I think that's a good question for the DOE and the private schools, Catholic schools.
Yeah, I don't think they can if we're in PCOR 1.
There's a percentage of occupancy that they're allowed to have, so that will reduce the number of children that actually can attend the child care facility. Right. The situation with the schools, and again, yes, they're the subject matter expert to talk about that, but if we're limiting the child care facilities on how many children can attend, that will put a further strain on the school systems, because now if you're allowing some to come in person, but the teachers still have to do online classes, we don't have extra teachers to accommodate the two settings, that's a further strain on DOE and makes it difficult. Right. And so that we're dealing with larger classrooms, and so that's something that we're not in the PCOR stage that allows these schools to reopen.
Yeah, but we can't really say anything about the PCOR stage we're in because PCOR 1 is basically out the window.
Yeah, we're like what do they call it? PCOR 1.5.
We call it PCOR fun around here. Around these parts.
The original PCOR designations were designed to how do we get into from PCOR 4 back down to it wasn't designed to go the opposite way. So it's basically playing it as let's do it, figure it out as we go along, kind of thing.
Real.
Oh wow,
that's real comforting.
Feels so good.
Yeah.
I really don't know if I don't think that there's been a formal designation for how to go back and forth. It's not like typhoons because we still don't know.
No, there was.
And when the surge happened, it was more of a dire emergency because the hospital was overwhelmed and people started dying. That was just a call. Oh, no, let's lock it down again. Doesn't seem like a lockdown to me, except for the stores being closed. If you look at the traffic, it's gone down a little bit, but it seems like normal traffic to me.
PCOR fun night.
Yeah, it's PCOR fun.
Well,
No, but Doc,
just
Doc.
Public
the
health
executive order.
emergency peak or
There are
flood.
limitations. There are limitations on social gatherings and congregation. That's really important to
Right.
keep that going. And it's
Okay.
like, don't forget the masks and the social distancing. This is not going to go away. You still have to stand 6 feet away from people and wear a mask,
Right.
and no large parties, etc. And I think she's trying to incrementally open up and see what happens, see if people can behave. And it's really not just individual responsibility. It's individual responsibility for you as a person, but what you're doing is what you do affects the community. So it's really both an individual responsibility and a community responsibility.
I like to refer to it as collective individual responsibility. So if we collectively be responsible individuals, then as a whole, we can beat this thing. Doc, I want to go back to
Some
what you
people
said.
don't follow the rules.
Yeah,
Okay.
right,
Yeah.
right. Yeah.
That's the problem. And you might have somebody come in on a plane and lie and say, "Oh no, I live here. I'm a resident," and they're not. And they go, all kinds of things can happen. People also lie about their phone numbers when they go into quarantine, or they give the wrong number or whatever.
Wow.
I mean, we can't stop people from lying and cheating and stealing. There's
Yeah.
always bad apples, but we want to see, the community kind of still come together and work on this. Nobody wants to see these premature deaths.
Yeah. I mean, there were rules to moving from PCOR to PCOR, but they threw them out the window. So we were told that, the testing positivity rate has to be declining. It's not really. I mean, it was 14%
Downward
yesterday.
trend,
The last 7 days, it's
cases,
9%. Yeah.
Hospitalizations,
Right.
testing capacity.
Hospitalizations decreased because so many people are dying. Yeah, so there were rules,
Yeah.
Doc, and they just changed them in the middle of the game because there was a lot of political pressure, and that's where we're at this interesting place where we definitely have to restart the economy, but at what cost, right? So
Yes.
It's basically
Exactly.
you just have to go out there and you're taking a risk every time you step out the door. So protect yourself and wear your mask. We're on our own.
yeah, because you're hearing it right from the subject matter experts that the virus is spreading. Present tense.
You can also make choices. You can say, "No, I'm not going to this. I'm not going to church. I'm going to stay home," and whatever. "I'm going to not participate in this party. I am not going to go to this fiesta if there is one." You can also choose to isolate yourself and say, "I'm not going to do those things because I don't want to put myself or my family at risk."
Right. Or you could be like, I'm going to wake up tomorrow and I'm going to go get the dog a skin tight fade. Then I'm going to go get a tattoo. Then I'm going to grab a workout at the gym. And then I'm going to go to
go to the
mass.
gym.
And then we're going to go to Ross. And then I'm going to go to the daycare. And then I'm going to have my gathering of 5, but it's really going to be 500. Yeah. Our people. I a day, our people. Let's get our act together, guys. Really. Annette, we're kind of going to wrap
Yes.
here, but where are we with this? So, and I just wanted, we had 62 positives yesterday.
Yeah, that's what she said.
Yeah. So what can you tell us about anything more specific than other than household contact?
Any clusters?
Well, unfortunately, because we're seeing more households coming down with COVID, you can say there's clusters within that large household size. We're working with again dealing with work contacts and getting people screened and tested, getting them isolated if they're new cases. We just had some individuals yesterday asking to be separated because another family member became positive, and so they want to be moved to the ISOFAC so they don't further expose their loved ones at home. And unfortunately, that's what we've been dealing with over the course of the past month or so. As we see the numbers go down since that big spike end of July, August, we're still dealing with double digits, and unfortunately, that's what I have to keep repeating to people. It's people your love, it's your family, it's your friends that unknowingly are spreading it to you. We're still seeing individuals symptomatic and asymptomatic. Unfortunately, they didn't know. And I know it's this whole, we need to recover the economy. And again, there are individuals who they're the breadwinners of the family and they have to go to work. But, but if you're symptomatic, you got to stay home. There are people, how many days they're symptomatic, they're not seeking medical care, and they're going out and about, and then unfortunately they're going to the hospital because it's been days or a week that they've had a fever and their symptoms have worsened, and then finally they're overwhelming GMH, where they could have gone to their primary doctor and be seen sooner and avoid overloading GMH. They already have a lot on their plate. They got to focus on the really ill and help those recover, help our frontliners, give them some breathing room and give them a break as much as possible. So, it's just, again, behavioral change. I hope people learned and, our hard lessons from that July-August spike. We haven't even come down from that curve. So again, as we reopen slowly, I hope people, again, don't relax too much, they don't need to go to Ross. That first day, and we saw the videos and the pictures of that long line. It was just very disappointing. I don't blame people. They're tired of being stuck in the house. But again, even just bringing everyone to go out and do simple things of shopping. Do you need to bring the whole family? Just one people, and do what you need to do and come back home, quickly and safely, so that you can help us stop the spread. Because again, we definitely can't do this alone. And again, it's just a constant, oh yeah, I was sick, but I went to work. Oh, I was sick and I went to visit family and friends. Oh, I was just there a few days ago, and to find out, oh, they got exposed, or they're the ones exposing people.
Thank you, Annette. Dr. Ann, final words?
Related to that, I don't know if they've changed it, but in the Philippines, they only have one designated household member who's allowed to go out and shop for the family or the household. So, and they're seeing a surge over there, but they're also trying to open up, and so is Hawaii. So we just have to see what's going to happen and how people continue to behave. Because again, as Annette said, we're seeing mostly household contacts. That's the majority. There's some community contacts. We're seeing a lot more workplace spread, but it's households. But we don't have nursing homes, so we don't have the same problem that they do in the Estados Unidos. We don't have large nursing homes. The elderly stay with the families. That's part of the problem. They might get exposed there instead of at a nursing home.
Flexing your Spanish there, Doc.
All right.
So at the end of the day, really, everybody, if you don't have to go anywhere, just stay home. And if you do go out, wear your mask.
And social distance.
Exactly.
Yeah.
And don't wait too long to see your doctor if you're feeling sick. We don't want it where you wait too long and the only option is to call the ambulance and go to ER. Our healthcare providers have stepped up from day one, and they're doing their part. And they've said it all along too, is, see your primary doctor if you're feeling sick, just so that we don't overwhelm GMH's ER or GRMC's ER, because we want to make sure it's the really ill, the critically ill that are able to get in and be seen and have those ventilators and, and have the attention of our nurses, we don't, and the doctors. We don't want to continue to spread our healthcare providers too thin and overwhelm them, right? Because we're not out of it. Like Dr. Ann said, it's, we've got a while to go for this pandemic. And so, we've been fortunate. We had DOD come in and help GMH, but that was for a short time.
Yeah.
We will.
The rest of them leave this weekend.
So again, yes. So help us to help you to stop the spread and stay home. Cover your cough. Wear your mask. Stay home if you're sick. Wash your hands, as we can continue to emphasize that to the community.
Thank you, Annette. Dr. Ann, thank you.
Thank you.
You done, Dr. Ann?
Ladies.
Anything else you want to throw out?
No.
No, come on.
Good.
Come on, a little bit more. A little bit more. Come on.
Yeah, you have Dr. Wen there. You can ask him.
Oh, all right. Let's bring Dr. Wen on. Thanks, Dr. Ann.
Stay safe.
Okay.
Okay,
Bye. Be safe.
bye. Yeah, be safe.